Hello and welcome to the Oakland County Megacast. I'm Tyler Kieft alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we are on 88.1 WBFH, The Biff, as well as on Birmingham Area Municipal Access, both of our TV stations today and every day, Monday through Friday, from 10 a.m. to 12 noon. Are on Comcast Channel 15 and AT&T Channel 99. In addition, you can find us online on civiccentertv.com. You can click on our Watch Live link, and you will see each of our shows live from 10 a.m. to 12 noon. You can also find us online, civiccentertv.com/megacast, for each of our full episodes, all of our interviews, and even short clips from each episode live, online, in high definition, civiccentertv.com/megacast, as we continue to bring you all the top stories from around the state of Michigan and Oakland County in regards to COVID-19 and more. And making our top stories today at civiccentertv.com/coronavirus. Teachers are protesting in-person classes this fall. A group of educators and parents rallied in protest of schools reopening for in-person classes in Michigan this fall. The rally began as a car caravan which drove from Detroit to Ferndale High School, Oak Park High School, and Berkeley High School before ending at a park in Pontiac. Districts are coming down to the wire to plan for safety protocols, capacity, and potential hybrid learning, and several school districts in Oakland County have already released their back-to-school plans, which include hybrid of online and in-person classes. Others are offering virtual academies, and the event for this protest was organized by three coalitions, including the Michigan for a Safe Return to Campus, which is planning a rally at the state capitol next week, as well as teachers are preparing for the fall, and some don't agree with the idea of having kids back in school and being back in school with the kids in the fall, and think that we should continue to learn by virtual means. This is going to continue to be an argument being made by many teachers and teachers' unions as we approach the first day of school.
Hats off to all the educators and their administrators in trying to even manage this crisis. They really have done a good job of trying to plan for all these different potential scenarios going into the fall. I know it's not making everyone happy, but they are trying to provide for the majority within their communities, because if we say, hey, complete virtual, what about those families that their parents have to work or they don't have access to all the learning tools that they need? Then we're leaving a vulnerable population out of this equation. So no easy answer to all of this, but we're going to continue to see this develop as we get down to the wire and where we stand as a state in phase 3, phase 4, or possibly even phase 5.
The good thing about this is, one way or another, the school districts have plans in place for both scenarios, but it does bring up the question, like you had said, Ronnie, if we're not going to educate them in the classroom, we need to be able to make sure that we can educate them virtually and do so effectively, and that's going to require some extra aid for a lot of school districts to provide those means to families that don't have them, to ensure that that's going to happen. So that's one of the reasons why we're seeing these protests, is because the teachers know that is the case in virtual learning, but also believe that teaching classes in person is not safe at this moment in time. Other top stories at civiccentertv.com/coronavirus. A popular splash park has closed due to a positive COVID-19 case. Kensington Metro Park's Splash Pad, Splash and Blast has been temporarily closed due to an employee testing positive for COVID-19. The positive case is a seasonal employee who last worked Thursday at the Milford facility. The positive test result came in on Monday, late in the day. Quote, ensuring the health and safety of park visitors and employees is always our top priority, Huron-Clinton Metro Parks Director Amy McMillan said. That's why we temporarily closed the Kensington Splash Pad due to a further deep cleaning, to do a further deep cleaning and make this public notification as a added precaution, and closed quote. Park officials believe the risk levels of visitors contracting COVID-19 from positive cases was minimal. The park is undergoing a deep cleaning and is expected to reopen this week. But a lot of precaution has to be taken in this case or you have a positive test in any work environment from someone, to make sure that all the employees that are going to be in close contact with that person or were on site are taken care of, and that you're making the people aware that we're in the areas where this particular person may have made contact with something or someone, that they need to take some time and be quarantined and or get tested to make sure that they're good to go, while the park does a deep cleaning and gets itself ready to reopen safely, free of COVID-19.
I think we're seeing this happen at more and more places, and this is going to continue to be an issue, not just at open parks, but also restaurants, museums, any place we go in public. So that always just reminds us, as individuals, we have to do things on our side, that we are protecting ourselves when we go to these locations. So make sure you always have hand sanitizer with you. Try to bring wipes with you as well, so that you can wipe down surfaces if need be, and make sure you have your mask, so that if they're not provided for you, you have the means to take those extra steps. So that I kind of look at it as someone out there wherever I go could potentially have COVID-19. So I do the steps to make sure that I don't get it as well. And sometimes that takes a little bit of extra responsibility on my part.
It does, and these companies and these businesses are taking precautions before there's an outbreak at any particular place of business or any area at their business, and they're taking precautions afterward as well to ensure the safety of the public that comes in to their facility, and to ensure that they are making sure their facility is clean and can operate regularly in the future, saving jobs as well. Other top stories at civiccentertv.com/coronavirus. 70 coronavirus outbreaks were reported in Michigan last week. Michigan Department of Health and Human Services Chief Medical Executive Dr. Jonay Caldoun said that coronavirus cases have recently plateaued in the state, but there is evidence of some community spread. As of Tuesday, the total of 79,176 confirmed COVID-19 cases and 6,170 deaths, an increase of 669 new cases since Monday. 31% are associated with nursing homes and adult care facilities. 22% are associated with social gatherings. 10% are associated with workplaces, and 9% are associated with restaurants. Officials say outbreaks have also been associated with child care facilities, agricultural work settings, bars, personal care services, and gyms. Outbreaks can vary in size, but it is the process of one or more people contracting the virus from a location and then spreading it to their close contacts, who then have the potential to continue spreading the virus. Yesterday, we broadcast live the press conference with Dr. Jonay Caldoun, of course, spoke on this issue alongside Governor Gretchen Whitmer and others. Here's Dr. Caldoun giving a little more detail specifically from yesterday's press conference on what an outbreak is.
So great question about how we define an outbreak. So every time there's a positive case, we do an initial case investigation, and then we identify, where that person has been, who they've been in close contact with, and then we go and call those close contacts. If we find that there is a close contact that's associated with that initial index case, if you will, then that's how we define an outbreak. And outbreaks can be different sizes, but once you have an index case and it spreads to other people, that's how we define an outbreak. For our nursing homes, sometimes we don't find out how the disease got into the nursing home, but again, we do the contact tracing in the nursing homes as well. We identify if staff may have it. We still have a visitation limitation as well for the nursing homes, and we continue to emphasize PPE for them, testing of residents and staff, and then just the best sanitation protocols that they can implement.
Dr. Jonay Caldoun yesterday, the Chief Medical Executive for the Michigan Department of Health and Human Services, at the press conference with Governor Gretchen Whitmer on Tuesday. You can watch that full press conference and see clips from that at civiccentertv.com/megacast. Lastly, vaccine trials are underway at Henry Ford Health System. The Henry Ford Health System is seeking volunteers to take part in the COVID-19 vaccine trial. Henry Ford Health System is the only hospital system in Michigan chosen as a Phase 3 trial site for the Moderna mRNA 1273 coronavirus efficacy, or COVE, vaccine study. About 90% healthcare systems across the United States are working competitively to enroll a total of 30,000 volunteers to participate in the Moderna vaccine study, 5,000 from the Henry Ford Health System. Participants could receive their first shots of the vaccine by the end of the week. Anyone age 18 or older who is not immunocompromised or pregnant or planning to become pregnant can volunteer for the study as long as they have not had COVID-19 or another vaccine or treatment. So that well underway at Henry Ford Health System. Good to hear that those vaccine trials are in this late phase of the process, and that they're being done right here in the local area.
Yes, so if anyone is interested out there and wants to be a part of the solution, I believe you can sign up now. Like they said, it's only about 5,000. So hopefully they get enough participants to quickly get through this. I believe the study is going to last about, 2 years? And then there is a small payment at the end for your participation. But the bigger payment is really your contribution to society and helping beat this virus.
Find more information about that on our website. You can go to civiccentertv.com/coronavirus, read through that entire article, see how you can get involved if you're interested in taking part in phase 3 trial of that vaccine. And you can find more information online about COVID-19 on civiccentertv.com/coronavirus. We have links to reputable resources such as the Centers for Disease Control and Prevention, the State of Michigan, Oakland County, and your local municipalities, as well as top stories each and every day. civiccentertv.com/coronavirus. We update that on the daily as we bring you the local news and information about COVID-19 and more here on the Oakland County Megacast as we continue through this ongoing coronavirus pandemic. It's ever changing. There's always some nuance to this as time goes on, and those nuances vary from month to month, day to day, and week to week. And to talk about that from a medical perspective, we're joined by our first guest today. He is Dr. David Donaldson, who is the Vice Chief of Beaumont-Troy the ER Center. Dr. Donaldson, thank you for being with us again today.
Yeah, no problem. Good morning.
Appreciate having you on. Since we've last spoke, how you been?
I'm fine. Staying healthy. Hopefully everybody else is.
Yeah, that is good to hear. We have continued to progress through the COVID-19 pandemic. We've seen a little bit of a spike in cases as of late in the state of Michigan. Dr. Caldoun yesterday had mentioned that's starting to plateau. It seems like that's back to under some control, so at least that's good news. We have not moved into phase 5 yet, out of an abundance of caution, but we're still very much involved in the COVID-19 pandemic. In terms of emergency room services, have they changed at all since we've last spoken? Have more services returned to Beaumont-Troy Hospital and to Beaumont-Troy's ER system that maybe weren't in place earlier on in the pandemic?
No, we're still doing our best to keep patients that have COVID or suspected COVID enter through a separate entrance, go to a separate portion of the ER. We're doing our best to do that. Luckily, we've seen the normal ER kind of cases return. There was a period of time, as I mentioned last time, that we weren't seeing the heart attacks, the strokes, the severe injuries. Patients were basically too scared to come in. So we've really been trying to get the message out that we're there with a clean, portion, non-infectious portion of the ER to care for you. So luckily, we've seen those type of patients come back and not staying at home with these serious medical problems.
Doctor, my father was recently admitted to the hospital in Ohio. One of the things that's so hard is still the limitation on visitors. What is the situation where you are?
So that has changed since we talked last. We do allow currently visitors for patients. We do limit it. We try to limit it to one visitor per patient in the emergency department. If it's a critical situation, an end-of-life situation, we make exceptions to that. Pediatrics, both parents can come back.
Dr. David Donaldson with us. He's the Vice Chief of the Beaumont-Troy Emergency Room Center on the Oakland County Megacast with us. So for those that maybe still are concerned to investigate what these ailments they may be feeling that may be symptomatic of heart attack or a stroke or other conditions that need immediate emergency attention, what kind of complications can be had as a result of not getting those checked out in a timely manner?
Sure. I mean, strokes, there's a very narrow period of time that we can actually treat you and provide some benefit to you. And if you wait too long, you're out of that window. The same thing with heart attacks. Again, you have to come in quickly. The quicker you come in, the quicker we can take care of you and get that taken care of. Same thing with traumas and injuries. I mean, I've seen situations that patients were scared to come in with bad injuries and suffered, long-term consequences because it wasn't cared for timely. So I just want to reinforce that we are safe. I mean, we have a safe area for you to come. If you have any hint of infection symptoms, fever, cough, you are brought to a separate area, and we do our best to keep that separated.
Dr. Donaldson, I'm just curious, I'm sure others are too, because in the times that we're in right now, every little symptom makes you immediately think, okay, maybe this is the beginning of COVID. Maybe I'm just, or you're thinking, well, maybe I'm just psyching myself out and this is just a simple cold or something. But in just a general sense, even beyond the COVID symptoms or COVID adjacent symptoms, what should people be considering before they go to an emergency room to determine if they need to go, if they should go in an abundance of caution, or if it's better for hospital resources and for them as well to stay home?
Sure. I mean, I think to break that up into a couple different parts, if I would treat your symptoms, your non-COVID type symptoms the same you would have before this pandemic started, just keeping in mind that we do our best to keep you safe. And, if you're having chest pain, if you're having shortness of breath, if that kind of stuff, don't be afraid to come in. We'll care for you the same exact way we did before this started. And then in terms of the second part with, if you wake up with a sore throat or the sniffles, it's easy to psych yourself out. I agree. But I do think we have to take those serious because that could be early signs of symptoms of COVID, And, the same thing you might have thought before all this started, hey, it's just my allergies or I've got the sniffles. I think you really do have to have the self-awareness that, you don't want to expose other people and do your best to stay away until it defines itself.
In the past, Dr. Donaldson, it's been advised that if you are feeling some of those symptoms and you're going to go to see your primary care doctor or you're going to go to the emergency room if those symptoms are more severe, that you should call in advance and give them a forewarning to make so that they can be prepared for someone that may potentially be COVID-19 positive. Is that something that's still being suggested today? What should people do when they are on their way to the emergency room if they're not going by calling 911 and being in an ambulance to make sure that those on the front lines are prepared for them to come in?
Sure. I don't think it's necessary you call ahead to the ER, your own doctor. I think that's probably very helpful. We have 24/7 a greeter nurse that stands outside of the building. So as you drive up, you are actually greeted in your car. And if you have any symptoms that we're worried may be COVID, such as what we talked about with the cough and fever and those sort of things, then you're escorted through a separate entrance into a separate area. So I don't think it's, to answer your question, necessary to call ahead, but you just want to make it clear when you arrive to that nurse while you're still in your vehicle of your symptoms.
So many people have tested positive, but they've been asymptomatic. What happens if they come into the ER normal channels and then you find out later that they are positive for COVID? And is everyone tested?
Sure. So to answer that, right now, everyone is not tested because there is limitations in the testing capabilities. The test that we use and most hospitals use is a very sensitive test. But the downside is there's not enough reagent to run that test for everybody in a hospital setting. So currently we do it by symptoms, but to answer your question, it is possible, just like it's possible to, walk into Target or Meijer and be asymptomatic and have it. So we always socially distance. We always wear a mask. The patient and the providers always wear masks. So we do our best. Just because basically we treat everybody as having it, at the time that we see them, because it's easier to be overcautious and undercautious.
Dr. David Donaldson with us. He's the Vice Chief of the Beaumont-Troy ER Center with us on the Oakland County Megacast discussing, of course, the ongoing COVID-19 pandemic as well as emergency situations in which people should still be going to visit a doctor at the emergency room. So in the past, we've seen people have been really cautious to go to the ER, and that did cause a lot of problems early on for people that had heart attack symptoms, stroke symptoms, other major injuries that they didn't go and get treated. And we've talked about why that is dangerous and why people should not be doing that necessarily. But in terms of now versus before, are people more comfortable going back to the emergency room when they have these symptoms from what you've seen? Or are we still in a position now where we're seeing people be apprehensive to go to the hospital to get treated for these emergency situations because of COVID-19?
I do see a little bit of apprehension in talking to patients and even friends outside of the hospital, but it has really taken a 180. Like I said, at the peak of this and end of March and April, it was terrible, the amount of patients that we saw that were suffering at home and either passing away at home or coming in, too late. It was unbelievable, the amount of patients that were staying home because they were afraid to come in. And again, I've seen a big change in that. It's not back to normal by any means, but it's much, much better.
As a cautious tale for those that maybe still are apprehensive and don't want to go in and get those symptoms checked out and want to tough it out at home, for those that in the past did come in after the fact and came in either too late, you mentioned some had passed away at home, but others had complications because of how long that they waited. What kind of complications could people experience if they do wait too long on heart attack, on stroke, on some of these other injuries that you have already seen, you and your team at the Beaumont-Troy ER Center have already seen?
Sure. No, I've seen, some of them we don't see because we pronounce them at home. So we'll get a call from EMS that, a patient has died at home and we have to give the medical direction that patient has expired. And we saw spikes, just tremendous spikes, end of March, April into May with that. And reports from families were that patients were having chest pain or patients, were having shortness of breath, and it sounds like they were just afraid to come in. So the stats actually bore out that occurred. That's just, it's not just my opinion, that the stats has borne that out in Macomb and Oakland County. So that was, a couple months ago. That has luckily trended down. But I've seen, we talked about the big stuff like heart attacks and strokes. I've seen cases of appendicitis that patients were afraid to come in and sat with appendicitis at home, for a week or two, and by then it's perforated and you have a whole other set of problems. I've seen bad leg injuries. I've seen open injuries, so actually bones sticking out that patients were afraid to come in. It's just stuff like that I just really want to get that message that, if you're having those type of issues, it's safe to come in. We're doing a good job, like I said, separating patients best we can. And then we've got plenty of personal protection equipment. That's not an issue any longer. So the safety is definitely there at this point.
I know that you're in the ER, but how are things going in the elective surgery area? Because I know hospitals really relied on those type of surgeries for their bottom line. Is that picking up again?
It is, and it's not just a bottom line issue, but it's also a patient safety issue. I'm obviously work in the emergency department, so I don't have firsthand knowledge, but in speaking with colleagues, there was a lot of patients with cancer screening that was not done, with cancer surgeries that were delayed, that had long-term effects from not proper screening, not proper removal of certain cancer type issues. So luckily that stuff has ramped back up, that these patients can get that care that they need, the preventative care as well.
I know we're pretty flatlined in this disease here in Michigan right now, but as you see what's going on in some of these southern states, are you still concerned that we could see a second surge and that maybe the hospitals wouldn't be prepared for it?
It's always a concern, but I've been intimately involved with this since the beginning at Beaumont, and just the lessons learned from the first wave, with everybody, I'm sure around the country, that if there is a second wave, we will be much more prepared. In fact, I've done some conferences with FEMA and some education pieces with some hospitals in Texas that we went through a couple months ago, and just shared all of our lessons learned with those hospitals and in terms of things that we did and worked well. So it's been a lot of communication. Before it hit us, we were actually in communication with a physician in Italy, some people in state of Washington, again, just learning from each other, because this is ever changing of what worked and what didn't work.
Dr. David Donaldson with us. He's the Vice Chief of the Beaumont-Troy ER Center with us on the Oakland County Megacast. This pandemic has taken a great toll on hospital staff. especially, as they have been working longer hours. Nurses, doctors, and other staffers working longer hours have seen on the front lines the toll of this pandemic on the community. How are the workers at the hospital holding up now that we're at a point where it's kind of stagnated in the state of Michigan? We've leveled off and we've returned some semblance of normalcy to our hospitals. How are they holding up now? Are they recovering from what they've been going throughout this pandemic?
Yeah, I think so. And I think a lot of that is the fear of the unknown is no longer there. So we know how to keep safe, ourselves safe, our patients safe. Like with anything new, when this first started, everybody was scared to death. But again, with the lessons we've learned, the lessons that we've learned from other people that went through this before us, I think the anxiety of the unknown has really gone away, and we know how to deal with this and keep ourselves and our patients safe. So that's really helpful with morale and getting, like you said, back to normal, some sense of normalcy.
So my niece is a nurse as well, and healthcare workers have been put on the front line of this pandemic. How much has the support of the community meant to you and your staff and all of those in the healthcare industry?
Oh, it's meant a ton. I mean, we were very well fed in the beginning of all this, which was nice. But the support of just seeing the signs, seeing the the ribbons. You'd walk out of work and there'd be banners hung, rocks painted on the ground, thanking us, and and parades. I mean, it was very, very helpful at the times that the morale was pretty low and that uncertainty was there. So, yeah, I mean, I think it was really helpful.
Dr. Donaldson, anything else for us today? Any other points that you want to make before we let you go?
No, I think we touched on everything. I just, again, want to reinforce that if you're having issues, we're there for you. COVID, non-COVID, the COVID numbers have definitely dropped, but we're treating, like I said earlier, everybody in our minds as having it until we prove they don't, to keep us and you safe.
Well, Dr. Donaldson, thank you very much for being with us today.
Yeah, thank you.
We appreciate it. Dr. David Donaldson, he is the Vice Chief of the Beaumont-Troy ER Center, with us on the Oakland County Megacast. And Ronnie, it's so critical for people, even now as things are stagnating, but even before when they were faced with emergencies, to go get that care, because these issues that you have in that moment, if you let them linger, the longer they linger, they have exponentially greater toll on your body and an impact on your body going forward, especially situations like heart attack and stroke. And it's good to hear again from Dr. Donaldson just how severe those symptoms can be if you let them sit and don't go to these hospitals that have put systems in place to make sure that you are very safe from COVID-19 when you're entering their systems.
Not just the emergency right now, such as a heart attack or a stroke, but think of all the people with conditions such as cancer and the cancer screenings. Everything was put on hold, and surgeries. And so now those can resume and people can get back to focusing on their health and do it with a sense of peace of mind, which the mental part of this is very important, just like the health of our body.
That indeed. We will take a quick break. When we come back, we'll transition and talk about schools on the local level. Oakland Community College will join us after this break. We'll be joined by their chancellor. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations. Ronnie and I will return after this quick break.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we're on 88.1 WBFH, a service of the Bloomfield Hills School District under the leadership of Station Manager Ron Whittables, and on Birmingham Area Municipal Access. In addition, today, we are on the Facebook page of the Greater West Bloomfield Chamber of Commerce, and thanks Suzanne Levine and her entire team at the Chamber for joining us today, and those members of the Chamber and fans of the Chamber who are watching for the first time, thank you for tuning in. This is the Oakland County Megacast, and you can watch us Monday through Friday, 10 a.m. to 12 noon, here on our family of TV, radio, and other media outlets as we talk to experts and people in the community about a variety of topics in relation to COVID-19 and other top stories, including our next guest. He is the Chancellor of Oakland Community College, Peter M. Provenzano Jr., joins us now on the Megacast. Thank you for being with us, Chancellor.
Good morning, Ronnie and Tyler. How are you?
Doing well. How have you been?
Doing fantastic.
So over the course of the pandemic, obviously, education has changed significantly at all levels. How has the education of students at OCC been impacted by the COVID-19 pandemic?
Well, it's really interesting because we were already in process of creating more online programs and classes because that's what our students really asked for. But the pandemic just accelerated that. Literally, back in our winter semester, in a little over a week, we had 600 faculty convert 1,500 classes from face-to-face to a remote format. So we doubled down on online learning, and we were already in the process of doing that. And so we were able to do it very quickly, maintain the excellent quality that OCC is known for. And this was essential to keep all of our students on track and to keep them safe.
In terms of plans for the fall, how have the lessons that were learned during that quick transition as the pandemic took its toll on the state of Michigan and the United States, how has that transition, being that it was so quick and so swift, impacted the plans for fall?
Well, it's like anything, you do something once and then you learn from it. And that's the key here, is to learn from, so we did incredible work. We did surveys with our students. They seemed to be very pleased with how we reacted and pleased with the quality of courses in the winter. And it showed in our summer enrollment. Our summer enrollment was actually up, total credit hours was actually up over 6%, which is really phenomenal. As you know, many community colleges and universities saw enrollment declines. But we didn't just rest on our laurels. We really have spent the entire summer perfecting and improving those courses. Our faculty have been going through a number of professional development trainings to just continue to improve those courses, to improve the experience of our students, as well as, we've looked back and found ways to improve our online services. All of our student services are now being offered online. We continue to improve technology. We now have a chatbot that is available on our website. We're investing in VDI, which allows students to take courses from home and access the technology from home. And what we're talking about is very complicated software that was only available at the college and in our computer labs. Now they have the ability to access that from home. So we continue to invest in not only our faculty and our staff, but also our technology.
Are you seeing enrollment increase going into the fall, or do you anticipate it to increase? Because I know enrollment's open right now. As parents find out whether or not remote learning is going to be required on some of the larger campuses.
It's still too early to tell. Our enrollment just opened up a few weeks ago, and enrollment will be open through the end of August. And it's not unusual for students to kind of wait to the last minute, right? They're much like adults, we tend to wait. And so I'm still optimistic, though, because we saw a tremendous number of university students come to us this past summer because of all of the disruption at their campuses. And so we continue to see that. We continue to receive calls from university students. What's really interesting is we're actually hearing from university students who plan on going back to their campus, living in their dorm, and take online classes at OCC because they saw firsthand the quality of the classes, the fact that many times, so we have excellent full-time faculty, but oftentimes our adjuncts, our part-time faculty, teach full-time at the universities, and these classes transfer to the university. So we're seeing an uptick in interest as well as enrollment in that direction. But there's still a lot of students that we're seeing that are just kind of sitting on the sidelines, and they're holding off because there's so much uncertainty out there, not knowing whether they're going to have a job, is unemployment going to be extended, or their kids. Most of our students are part-time, and so their kids may be in school, and there's a lot of conversation and just debate as to whether or not K-12 is going to be going face-to-face, and if so, how long? And so there's a lot of uncertainty out there. The other thing is, and so we're aware of that, we're talking to our students to help them through so that they know that we're here. It's a great place to stay home, stay safe, and stay on track, and we have all of the resources available online to make sure that they are successful. The one thing that we are hearing quite a bit of is with the likelihood or the potential that K-12 students, so your kids may be taking classes from home, everyone is trying to use the same computer, and there's a shortage of technology in many, many households. And so we have answered that. In fact, we're going to be announcing very soon that the first, I think it's like 3,500 students that register at OCC this fall will receive a free computer, a free Dell laptop. And we think that's going to go a long way to help them, not only incentivize them to come to OCC, but to help them with their technology needs as families are online and they're learning online.
How is that going to work with students that need to transfer the credits back to their universities? Or what if they want to sit out the semester while they're waiting to find out what's going on? Because I know your university, the great thing about it is that the price is so much cheaper.
Yeah, so we are the largest transfer institution in the state of Michigan. About 50% of our students that come to OCC transfer to a university. We have tremendously strong transfer agreements with, I'll say, all of the local universities, including universities around the country. And that keeps improving because universities see us as a tremendous feeder school to them. I think about 40% roughly of the local universities graduate students that transferred to them from a community college. And so our partnerships with universities are strengthening. More and more of our classes do transfer. But getting to your question, this idea, and you hear this conversation all the time about a gap year, because there's so much disruption, students are just overwhelmed. And I've heard some conversation about, well, I'm just going to take a year off. I'm going to sit on the bench, sit on the sidelines, and take a year off, take a gap year. I say, don't do it. Don't do it. There are so many ways that you can continue on with your academic journey, including coming to OCC, take some classes with us. They'll transfer to the university when they open back up, and campus life is brought back. The reality is this: we're seeing a slowdown in the economy. Eventually, the economy will improve. It always does. And when the economy improves, employers will be hiring, and you're going to want to have that education. You're going to want to have that training, that certificate, that degree, so that you can land that high-paying job right away, and not be faced with, well, now that employers are hiring, I need to go back to school. That does not give you a competitive advantage.
Peter M. Provenzano Jr. with us. He is the Chancellor of Oakland Community College with us on the Oakland County Megacast. So, Chancellor, you've spoken at length about the improvements that have been made to the online course material for Oakland Community College, and the work that's been put into that, and the extra incentive that's been put into making that as effective as possible as a result of the pandemic. In terms of fall education, some people learn better online, some people feel they learn better in person. What are the plans for the fall semester in terms of in-person, in-classroom learning? Is that going to happen at all at Oakland Community College at any of the campuses?
Well, what we have found is the best way to keep students safe, keep our faculty, students, and employees safe, and to provide high-quality instruction is to offer as many online and remote classes as possible. So in the fall, that's what our focus is going to be on. Mainly remote and online. We will have some hybrid, what we refer to as hybrid courses. And those are courses where, for example, a lecture will be offered online. But if there is a face-to-face component that is so difficult to teach online, for like culinary or police academy, welding, there'll be very limited activity on the campuses for those types of courses. And when students are on our campus, we're going to keep them safe. We're going to keep them socially distant, masked up. We'll have hand sanitizers. All the classrooms will be sanitized, after use. And so it's all about keeping students safe. Students want quality and they want certainty. With certainty, they want safety. And we think this is the best way in the environment that we're living in to provide all three of those.
Because so many of your students do only attend classes part-time and they work as well, do you think this model will remain in place post-pandemic?
It's very interesting. We were talking a lot about that. No one really knows, but what I do know is this pandemic is going to change everything, not only for education, but I think for society. There are so many things that are going to be different. I don't see us going 100% online all the time because, as you mentioned, many students learn better face-to-face. So I see us continuing to offer face-to-face classes. But what we are learning is there are classes like Auto Lab that we never thought we could even teach in a hybrid format online. And we're finding creative ways to do that. And so I think what's really going to happen is students are going to have more variety. We're going to be offering more variety than ever before, which really helps access. There are many students that have transportation issues and aren't able to make it to class, or they work full time and they really want more online classes. So I really see in the future us continuing to offer face-to-face, but more online, more students are online. And I really think that's great news for the community as well as our students.
Chancellor Peter M. Provenzano, Jr. from Oakland Community College is with us on the Oakland County Megacast. Chancellor, you've mentioned before that there may be some additional students that will be enrolled at Oakland University potentially in the fall due to uncertainty with the universities. And with that comes a lot of people that are in a variety of different programs and in a variety of different points in their educational journey at these other colleges and universities. With the transition to mostly online learning, has Oakland Community College worked on developing or even has implemented more potential classes for the fall and going forward to provide more of that variety to people, knowing that there may be a larger group of people coming in with different educational paths?
Yes, and we were already on that track. Pandemic accelerated that, but in the future, we already have plans in place. So this summer, we've added, or I should say this fall, we've added more online classes. Over the next few years, not only are we adding more online classes, we're adding more 100% online programs. So you'll be able to, we'll offer more degrees that are able to be achieved 100% online because we're seeing a huge demand from students, especially those part-time students, as I mentioned. Maybe the only time they have available to take a class is on a weekend, or maybe they work during the day and they want to take classes at night. This gives them so much more flexibility. And so we're building the infrastructure. And so I see us continuing to offer more and more online classes and student services as a convenience to our students.
Chancellor Peter M. Provenzano, the Chancellor at Oakland Community College, with us on the Oakland County Megacast. So we're going into the fall, and the state's COVID-19 case numbers have started to level off a little bit. If we get a month or two down the road and Governor Whitmer brings us into phase 5 and we get a few months later and we maybe magically end up in phase 6, would there be any plans in place for Oakland Community College in the fall semester to have a return from a fully online to hybrid altogether or in-person classes? Or is it going to be all virtual and some hybrid, as you mentioned, for fall, and then the return transition would happen for the next semester over?
What I could see is if that miraculously happened, and I hope it does, we would then react to that in a positive way by opening up and creating more activity on the campus for our winter term. I don't see us, it's highly unlikely we would ever change the fall term, because what we've heard from our students is don't mess with my schedule. If I take an online class, keep it online. They really dislike what happened this past winter, understand that it was out of everybody's control where we had to flip face-to-face to online. So what we've heard from students is don't mess with the schedule, make a commitment for the semester. And that's exactly what we've done. If things loosen up in the fall, we'll definitely consider that for the winter term.
We've talked a lot about the students. What about your staff and the professors? How are they handling this, and will some of them return to the office setting?
Very limited return. And so we're allowing faculty to come back to their office if they need to pick something up, or some are doing online learning and they're doing video in our studio, so we'll have them come back to the campus. Again, if they're teaching in the fall a hybrid course, there may be some lab work that they'll come back and teach a class, keep everybody safe. But the thought is we've been very successful in providing online classes, online services remotely, with people working from home remotely. And I don't see any reason to change that. By bringing, the more people we have on campus, the greater the risk is that the virus will spread. And then, as you can see what's happening in the sports world and other companies, when you have a couple people that contract the virus, now there's a quarantine and you just lose momentum, you lose productivity. And so I really see our strategy really has been to keep everyone safe, students and employees, focus on remote learning, working from home remotely, and it's been working. It's been a tremendous success, and because of that, we've been able to keep people safe.
Question about the remote learning. Is it taped lectures that the student can go and visit at a later time, or is it appointment setting, just as if they were going to class and let's say the professor is teaching it like in a live setting?
It can be both. We have classes that we refer to as online, and those are available to the student 24/7. So it's taped, and you can consume that education at any time that you'd like. And then we have other classes that we refer to as remote, where there is a scheduled time, maybe Monday, Wednesday, Friday at a particular time. And that can be a face-to-face interaction. We call it synchronous, where a student may be expected to meet with the rest of their class, including their instructor, on a given day and time. And so we have times allotted for that schedule so that they can plan their schedule accordingly. Students like both. Some students love that face-to-face interaction, and so we're providing that online. Other students say, you know what, don't need that. I'm more than happy watching a video lecture, and I want to be able to watch it in the middle of the night if that's what I want to do. And so we're offering both.
Chancellor Provenzano, anything else for us today before we let you go?
I just want to just reiterate the fact OCC is an excellent place to stay home, stay safe, and stay on track. Do not think about a gap year. I think that's a really bad idea.
Well, we thank you very much for being with us today.
Thank you so much. Appreciate the opportunity.
Appreciate it as well. Peter M. Provenzano, Jr., he is the Chancellor at Oakland Community College. They have multiple campuses in the local area and are preparing, just like other schools, for fall education. And they've taken a different approach where they were able to get a hold of and get control of their online learning. And it was so successful, and they found so much use for it that they put more effort into that for the future, and that's helping them through this pandemic.
I like their approach of some classes for people such as yourself that you liked having that schedule and being accountable for a class at a certain time. So they have that opportunity, but then they also have it online. So if you can't make that appointment class, maybe you do it at 1 a.m. and you watch the lecture. Part of college, to me, or any class, is that interaction back and forth between not just you and the professor, but the discussion with the other students as well. So a little bit harder to do that, not in a classroom setting, but there is still that possibility, like over a video platform.
And it's nice, too, because it provides that flexibility to where you could have a situation where you have a class live at 10:50 a.m. and it goes 10:50 to 11:20 Monday and Wednesday with a lab on Friday, and you have a live class online that you can participate in with other students live and have those conversations and ask those questions. But then somebody else that can't participate live can still participate after the fact on their own schedule, whether they're parents and they're navigating their kids' school and other activities schedules, or they're working and they're trying to keep themselves financially afloat during this, and they only have time, like the Chancellor said, at 11 o'clock at night or on the weekends, that they can go back and engage in that conversation as well. Maybe not live, but still get those questions, still get that conversation, and still get all that extra learning. So really nice to see all those efforts being put in place by Oakland Community College and their entire team there to emphasize further training, further emphasis of online learning as they prepare for the fall and take as much caution as possible. We'll take a quick break, and when we come back, we'll speak with Erica Jones. We have her out in the field, and then we'll continue with our second hour of the Oakland County Megacast. You are watching on our and listening on a family of TV and radio stations. Ronnie and I will return after this quick break.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we're on 88.1 WBFH The Biff and Birmingham Area Municipal Access. Both our TV channels on Comcast Channel 15 and AT&T Channel 99 all throughout the local area, as well as online on CivicCenterTV.com. Click on our Watch Live link. You can watch us live on CivicCenterTV.com, or you can watch us live on one of our Facebook partners each and every day of the work week. And today, that partner is the Greater West Bloomfield Chamber of Commerce, and we thank them for being with us today and their entire team for putting our show on the air today from 10 a.m. to 12 noon live with them. We have our Erica Jones, field reporter Erica Jones, out in the field now to give a report on local courts, and they've been closed, so a lot of courts have not been having in-person services. Maybe some people have not been able to access services online, and those fines you've had to pay have gone on a little bit too long, and you have some late fees. Well, Erica Jones has some news that you may like to hear on that. We have her out in the field right now. Erica, what's going on?
Hey, Tyler. So I'm here at the 48th District Court on Telegraph in Bloomfield Hills. And as you said, courts have been closed, and due to the state of emergency, there is some leniency. Courts have some policies. So here in Bloomfield Hills at the 48th District Court, they have a late fee forgiveness program. Now, this program has been going on since June 15th, and it does end in 2 days on July 31st, this Friday. But the program is that all fees for civil infraction cases, so traffic tickets, parking tickets, more minor stuff like that, misdemeanors, they are waiving all late fees. So you have until July 31st to pay those fees with no penalty. And you cannot go into the courthouse to give those checks. However, you can mail them to this address, which you can find on their website of the 48th District Court, or they have a drop box outside of the court where you can come in, similar to we saw with election ballots with drop boxes, and you can just drop your checks in that drop box, and you have until this Friday with no penalty, and your late fees are waived. Your late fees are waived, so you don't need to worry about those. So very nice forgiveness program, and it is specifically for cases that have been within the 48th District region. So you can't, have a case in Royal Oak and then come and have your late fee waived. But if it's within this jurisdiction, you're able to have the late fee waived until this Friday.
Erica, for those who are in the 48th District or have tickets or other infractions in the 48th District, who can they contact to find more information? Or if they're unsure if they can pay these fines at the 48th District Court, who or what number or email or whatever it may be can they contact to get more information?
Yes, so if you go right onto the website of the 48th District Court, they have a notice about this program, which it's very windy out, but I have it right here with me. And at the bottom of this notice, it has 2 phone numbers that you can call to reach the court, and you can find out information on exactly how much you owe, and also get the information that I'm giving right now about where you can drop off those fees and how long you have to do that. And you can call Monday through Friday between 9 a.m. and noon. So it's a 3-hour window to do so. Those 2 phone numbers are listed on the website at the bottom of the notice. Like I said, you can just give the court a call and they can give you any information that you need.
Erica, quickly, sorry about that. We're just going to cut your audio for a moment. It's very windy, as you had said. Could you provide us with 1 or 2 of those phone numbers real quick?
Yeah, of course. So you can call the court at 248-686-5150. Again, that's 248-6. It's very windy. 686-5150. Or you can call 248-686-5148. Again, that's 248-686-5148. So either one of those numbers you can call to reach the court Monday through Friday, find out the exact amount you owe, how long you have to do that, where you can do it, and any of the other information. Or if you don't necessarily want to call, again, you can just go to the website of the 48th District Court, and they have the notice about this program right there. But make sure to get this done quickly because the program does end this Friday, and it started quite a while ago on June 15th. So people have had about 6 weeks to take care with forgiveness on those late fees.
Erica, thank you very much for that report. Erica Jones at the 48th District Court, as they are providing for civil infractions within the 48th District. Fine forgiveness program, as Erica said, that expires on Friday. If you want more information on that, you can call a couple of numbers, 248-686-5150. That's 248-686-5150 or 248-686-5148. 248-686-5148. Again, this is only for civil infractions, as Erica had said, in the 48th District Court coverage area. We're going to take a quick break, and we'll come back with the second hour of our program. We'll talk more about the medical response to COVID-19 as that continues on and impacts our local hospitals. And then we'll get a little bit of motivation later on here on the Oakland County Megacast. You're watching and listening on our family of TV and radio stations. Ronnie and I will return after the break.
Hi, I'm Dr. Jonae Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. Today, we are on Comcast Channel 15 and AT&T Channel 99, as always, on Civic Center TV in West Bloomfield, Keego Harbor, Sylvan Lake, and Orchard Lake, and Birmingham area municipal access on those same two channels, Comcast Channel 15 and AT&T Channel 99 in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. In addition, we're on two great community radio stations, 89.3 WBLD Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, and 88.1 WBFH Bloomfield Hills, with service out of Bloomfield Hills High School under the leadership of Ron Whittables. We thank Uncle Ron and the entire team over there at the Biff for joining us here on the Megacast Monday through Friday, 10 a.m. to 12 noon, and with you for replays in the afternoons and on the weekends as well. You can find more information on the Oakland County Megacast on our website at civiccentertv.com/megacast. Find information about our partnering stations, about the show itself, and watch full episodes, short clips, and our full interviews on demand 24 hours a day, 7 days a week. civiccentertv.com/megacast as we continue to bring you the latest news and information about COVID-19 and other news in the local area that going on in this historic time that we're living in. And the coronavirus pandemic continuing to have an impact on hospitals. We talked about the emergency room perspective earlier on in the program. Let's talk a little bit more about the general medical response and how that continues to affect hospitals. We're joined now by the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Once again, Dr. Manu Malhotra with us on the program. Dr. Malhotra, thank you for being with us.
Thanks for having me. How are you doing?
Appreciate having you on. We're doing well. How are you? How's your team over at Henry Ford West Bloomfield?
Doing very well. I think things are stable, and we have learned a lot over the course of the last several months. So we feel that we're in a good position to make sure that we're keeping our community safe and healthy.
The COVID-19 response obviously had taken a toll on hospital workers, had taken a toll on hospital operations. Now that we're back in some semblance of normalcy, some regular operations have returned, and we talked about this before with President Wallace from Henry Ford West Bloomfield Hospital. How are things now at the hospital as they're starting to return to normal? Are we seeing more of the normal medical cases come back to the hospital, or are some of those still on hold as the pandemic continues?
No, we are fully operational, and all procedures, all clinic visits, all testing is operational. So we are, by and large, operating more or less as we were prior to the start of the pandemic. So there is, at this time, no limitation to the services that we're offering, and no reason to hold off any services that people need. One of the things that hasn't gotten enough airtime probably is this concept that over the several months of the high COVID infections, very important, critical, and basic health care got somewhat neglected. People were so afraid to come to the hospital that even for things like strokes and heart attacks, they didn't come to the hospital. And that's really not something that we can have. So we want to make sure that people are aware that their usual and other health needs still need to be addressed regardless of what happens with COVID-19.
How is the hospital prepared as far as supplies such as PPE if we have a second surge in the fall?
We are well prepared for that. To be honest, this hospital never ran out of PPE at any time. Unfortunately, there are clearly some hospitals and hospital systems that were not so lucky. We were fairly well stocked to start out with. From what we've learned by the increased burn rate the first time around, we've increased our PAR levels, so we're holding even higher amounts in stockpiles. So I think everybody's learned from this experience. We weathered the first spike pretty well from a perspective of personal protective equipment, and we anticipate that if there is a second one, that we are in very good shape to be able to deal with that.
Dr. Manu Malhotra with us. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Dr. Malhotra, Henry Ford is now involved in a vaccine trial, phase 3 vaccine trial, in partnership with Moderna and their COVID-19 vaccine. Are any of that operations being done out of Henry Ford West Bloomfield Hospital? Or if people are interested in getting involved with that, are there any first steps that they can take through Henry Ford West Bloomfield that you're aware of?
Yeah, so the current recruitment for that is happening through Henry Ford in Detroit. However, we are just opening conversations about starting to recruit on this campus as well. So even though that is not currently happening, that may happen over the course of the next several weeks. But in the current environment, it is the recruitment is happening out of Detroit. There are online forms that we can provide for you, the online links where you can get the initial screening completed and then sign up for eligibility. So that can be done online.
Can you talk a little bit about the collaboration within the medical community to try to combat this virus?
Yeah, I think this is really, a common enemy, and really we need all of the different components of the healthcare spectrum to work together to make sure that we're keeping the communities safe at large. So we spent a lot of time over the first several weeks to months of this pandemic actually improving and building interfaces with the rest of the healthcare community, where maybe we hadn't been doing it as much previously. So one of the first things that we did at Henry Ford West Bloomfield was actually connect with our local skilled nursing facilities and start a daily dialogue about what the situation on the ground is here at the hospital and at the nursing facilities, so that we could make sure that there was no lack of communication when patients are being transferred, which inevitably they would be, so that we know what everybody's PPE, personal protective equipment situation is, to make sure that everybody's using the same protocols and that there's full transparency when we do run into any problems. So I think that has been a very fundamental actually positive as we moved through this. At least in this community, we had a lot of very positive collaboration with physicians in the community, with skilled nursing facilities and rehabilitation facilities, with first responders, and really anybody on the healthcare spectrum.
Dr. Manu Malhotra with us. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Dr. Malhotra, in the recent weeks we've seen that particularly COVID-19 testing has seen delays in results coming back from the labs. From the hospital's perspective, as you're treating patients who are potentially COVID-19 positive and have been tested by the hospital, or other patients as well that you're testing in an abundance of caution, is there any priority in terms of which of these tests need to be back as soon as possible, and any way to work with those labs that Henry Ford is collaborating with on their testing to ensure that these patients are at the front of the line and their results that may be more timely are not delayed?
So Henry Ford Hospital does all of its testing internally, at least for our active patients. So if there's more of a public screening, that is where we may have some send-outs. But for any patients getting care within the Henry Ford Health System, we do all of our testing, and all of it turns around within 24 hours, the vast majority of it within 12 hours, and most of them even much earlier than that. So we're dealing with real-time information in those cases, and we don't have to appeal to anybody else to help us with that.
Dr. Malhotra, that is good news to hear from you, that patients at Henry Ford West Bloomfield Hospital and others in the Henry Ford Health System will not have to wait for those delays that have been affecting a lot of other people throughout the state of Michigan. So going forward, as we continue through this pandemic and as some sort of normalcy returns, what is your team doing to continue to stay vigilant and prepared in the case that there is another spike or that there is a second wave later on?
Right. So I think we're all proceeding as if it is very, very possible that we will have a significant second wave, second spike. However, that doesn't mean that we, stop business as usual. I mean, we need to be in the business of providing care for patients that is well outside of the COVID-19 response. So primary care, ongoing health maintenance, elective surgeries, and things that are tests, screenings, all of those things are still necessary, and we're going to continue to do those. We're going to do them in a way that is slightly different. You'll see that everybody in the hospital is wearing a mask. That's required. I think there's been a lot of conversation around masks, and frankly, some of it is a bit unnecessary. We know that masks decrease the risk of transmission, and in the current milieu, we should all be wearing one anytime that we are at risk of exposing anybody else. That's indoor, unable to social distance. Clearly, anytime we're in groups that are any larger than a few people. So, very strongly putting in a word for wearing masks. That's what's going to keep Michigan ahead of the pack. I mean, we've been doing very well so far. We did have a bit of a ramp up in cases more recently. However, we're not seeing a very steep increase. And I'd like to say that if we continue with the social distancing, the mask wearing, and the commitment that the state of Michigan and the people here have made to keeping each other safe, that we may come out of this without any significant second spike. However, we have to be prepared for it. So whether it is the vast abundance of, disinfectants that you see, the frequency of cleaning that's changed, the fact that we are minimizing non-essential traffic through the hospitals, controlling, the ins and outs and touch points, those are all the things that we've altered to minimize any risk. But we have to also accept that we no longer live in a risk-free environment from that perspective. And there are no risk-free alternatives, just commitments to making every interaction that we do minimizing the risk of those situations. And clearly that's a question everybody has to ask themselves as we talk about moving into schools in the fall and all that also.
This, this pandemic has sparked a political firestorm, especially around possible treatments. What do you want the public to know about the science of this virus and how to cut through the politics to be well informed and knowledgeable so that we don't continue the spread?
Yeah, I think it's a tough question, specifically with regards to how do we make sure that we're all consuming the correct information and doing a good job of really sidelining the information that is not validated. So I think the first thing to know is that we are getting better at treating this. So we do have an abundance of research coming in that suggests that steroids work, that suggests that remdesivir antiviral works. So one of the components in the decrease in the mortality rate from this probably is that we're getting better at it. We've learned a lot over the course of the last several months. But the reality of it is, and the reality of science is, that this information is continually being improved upon as we learn more. So I think the first thing to realize is in science, that we should be humble about the fact that we don't know everything and that we will continue to learn and, adapt to the new information that comes in. So I think any conversation around, oh, look, they said that, and then they changed their mind, so that nullifies the fact that this was a scientifically relevant information, I think is the wrong way to look at that. So I think that we should be always hungry to get more information and make sure that it's validated by legitimate studies. Unfortunately, there are plenty of people out there with seemingly appropriate credentials touting what sounds like research, and a lot of it's complete hogwash. So I really feel for the average person in the public that wants to be an informed consumer of this information, and the difficulty that they're having with this information coming through such a polarized and political view. I think there should be nothing political about keeping people safe. There shouldn't be anything political about masks, and there certainly shouldn't be anything political about which treatments work and which don't. So to the extent that we're able to all work together, I think we'll have a lot of success. I think the fast tracking of the Moderna vaccine testing is a good example of people working together to find solutions. This is a very fast-tracked process to get to phase 3, and all indications are that we're not cutting any corners on safety, and what we've done is, in collaboration with the government, cut a lot of red tape and save ourselves time that way. So hopefully we'll have something positive to report on that.
Dr. Malhotra, anything else for us today before we let you go? Anything else important for our audience to know that you'd like to discuss?
I think I did touch on this. Please do not defer the healthcare needs that you have, whether these are health maintenance, screening, elective, or urgent issues. Emergency departments, hospitals are safe to go to. We are taking every precaution, and there really aren't reports of any spread at the hospitals anymore. So, as we've learned more about this, the hospitals may be the most focused on making sure that there is no spread. So please do make sure that people are aware that they need to follow up and get the care that they need. I think that's number one. Make sure that people are wearing masks. That is an essential component of keeping these cases under control in the short run. And then, the other big thing is, these are high stress environments. So please be kind to each other.
Well, Dr. Malhotra, thank you very much for being with us today.
Thank you.
Appreciate it. Dr. Manu Malhotra with us from the Henry Ford West Bloomfield Hospital. He is their chief medical officer, and a lot of interesting points to be discussed with Dr. Malhotra. Get the point of view from the hospital. Really good to hear from them that patients that do go to the hospital and are either being tested in an abundance of caution or are being tested for what is presumed to be COVID-19 are still getting those speedy results with no delays. And I don't know if that's the case at other local hospitals necessarily that maybe are doing their own internal testing too. But good to hear that if you go to Henry Ford West Bloomfield Hospital for medical attention and you are getting tested, that you're going to get your results without a delay and be treated as soon as possible.
Contact tracing. Let me get that out today.
It's tough.
I want to let you know I only had like one little coffee, so no Red Bull. I'm trying to get off of that. But the tracing is so vital to trying to contain the virus. And part of that tracing comes down to how quickly they can get the lab results. So there's a big difference between 1 day, 24 hours, 48 hours, and 7 to 10 days, which some of the results are taking. So it's vital to help contain this virus and get control over it so that we can minimize the spread and hopefully move into that phase 5 soon.
Yeah, we'll hopefully be able to get some more information in the coming days on updating us on how those testing delays are progressing, if there still are major delays, or if those delays have been mitigated at this point. For that very reason, Ronnie, that contact tracing is so critical right now to the continued progress of the state of Michigan and the Michigan Safe Start Plan. Dr. Caldoun and Governor Whitmer talked about that at length yesterday, that they're keeping us in phase 4 because we saw a little bit of a spike. We're still at this point just leveling off and are a couple weeks out from seeing what's going on right now and how that's going to have an impact. And being able to contact trace and make sure that these minor spreads here and there and the continued new cases are not community spread or not major community spread is going to be critical. So good to hear from one of our local hospitals that their testing is not experiencing delays, and that if someone does test positive for for COVID-19, they're going to get the results within 12 to 24 hours and get that contact tracing process underway very speedily with our Oakland County Health Department. We'll take a quick break. When we come back, we'll learn some ways to stay motivated and stay positive in a time where it's really difficult to do both during this ongoing pandemic. That and more coming up. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, we're on Birmingham Area Municipal Access and 88.1 WBFH The Biff as we continue to bring you the latest news and information about the coronavirus pandemic and other top stories in the local area. And so much going on. Everything's going in a million different directions, whether it be COVID-19, whether it be social justice movements, whether it be returning to work or returning to school, returning your kids to school, whatever the case may be. There's so much going on right now, and so much of it is just taking a toll on our positive mindset and our ability to stay optimistic. And joining us now to help us through with some strategies to navigate all this negativity around us, we are pleased to be joined by a motivational strategy speaker and mindset life coach, Stacy Renee, with us on the Oakland County Megacast. Stacy, thank you for being with us today.
Hi, thank you very much for having me. This is great.
Yes, it is great to have you with us today. How have you been since we've last spoken?
Fantastic, keeping busy, getting everybody motivated, and constantly shifting their mindset. So it's something that we all need right now, as you clearly mentioned earlier.
Yeah, keeping a positive mindset during times like this that are so stressful, and there's so much information that's being thrown at us, whether we're seeing it in the news media, reading it, or just from general life. It's really tough to stay optimistic and keep that positive mindset moving forward. What are some strategies that you are suggesting to people that you are a life coach for, and just general strategies that you're suggesting to the public to keep that positive mindset going forward?
Sure. Well, thank you so much. And I think right now, during this time, and kind of always been in the past, but everybody seems to take things personally, depending on their own mindset, where they are in life, what's going on with them. If people don't return their text messages or their calls, they start to take that personally. And if you really look at it, you're making it about me, myself, and I. And the problem with that is you are just so absorbed into your own thoughts and the way that you think. And the reason why we do that, of course, taking things personally, is your ego. Shocker, I know. Your ego, the definition, if you really look at it, is a person's sense of self-esteem or self-importance. If we have all that in check and we're confident and we believe in who we are, we don't take things in a different context, a different way that it doesn't really need to be, right? Wouldn't you agree?
Yeah, I'd agree.
Absolutely. So when people are feeling like sad or hurtful, it's because they're not getting the response that they are expecting back from somebody. And I have a great analogy and a great tip and a tool. If we think about the $100 bill, which I have one right here, handy dandy $100 bill. And I like the $100 bill because, you got the ones, the fives, the tens, 20s, but $100 bill kind of just sticks out because, wow, it's a $100 bill. And if we look at the front side of the $100 bill, it's something where we first look at it and we say, oh, gosh, we're looking at ourselves and taking things personally, making it about me, myself, and I. We get hurt. But if you look at the backside of the $100 bill, we need to think about the other situation, the two sides to everything. And the backside really is maybe the reason why they didn't call you back was because they had something going on, or, you know, something last minute came up. Maybe they already had plans and they couldn't respond to what you had texted and go to what you asked them to because they didn't want to hurt your feelings. Maybe they're going through their own situation or something that testing that they had done, and maybe they didn't want to share it with anybody because they're not ready. So you really have to think about the $100 bill and the both sides to what the reality of it is, and don't take things personally. So if you have to get a $100 bill or just, you know, get a fake one, put it on your car, put it at your desk, and really try and remind yourself that, okay, one, they probably didn't respond right now. They have something else going on. Two, there's probably a reason. And I think the biggest thing that we also need to worry about and think about is that you really don't have to be invited to everything. You don't have to be a part of everything. And I think that we need to be constantly reminded of that fact and look at things in a different perspective, because your mind, your thoughts can really take you down and take you down a horrible path. And it just makes you feel horrible about yourself. And nobody needs to be in that mindset or that life, because it's really not a good place to be.
Stacey, I was excited when I saw that you were going to be on the program today. I follow you on Instagram. For those who don't, she's Mrs. Michigan. And you are very, very positive. And when you see a post, it kind of will help shift how I'm thinking. But you are a very social person and out at so many community events. And for all of us that rely on socialization and the parties and being involved in volunteering, and we've had to take a back step to that. And now we're having to spend more time at home with just a few people. If someone is starting to go down that path of feeling lonely, how do you advise them to shift out of that?
Very simple. One, you can kind of stop looking at the social media aspect until you get yourself in check, because people are always posting happy, positive things. Of course, you know, you get your one or two that post something negative, but, you know, looking at other people's lives and comparing them to yours, because you're out there, oh man, I could have been to that. I should have been to that. And here I'm home and I have to worry about, you know, not getting anyone exposed, or just, you know, it's a mental mind game. But once you get beyond that point, there's something that I call the Positive Shift Toolkit, and it's called CCD, which is cancel, clear, delete. Again, cancel, clear, delete. If you say that 3 times, if you're in that negative space, the negative, you know, zone that you're in, and you say cancel, clear, delete, cancel, clear, delete, cancel, clear, delete, it really does help you stop thinking negative. And then if you need to go further, stop your negative thoughts, is just have an affirmation, or what I like to call a mantra. And it's, I am awesome, successful, and smart. I succeed at what I put my mind to. Again, I am awesome, successful, and smart. I succeed at what I put my mind to. So if you say the cancel, clear, delete 3 times, you say the mantra 3 times, and let me give you a little tip, because I like ways to remember things. You can remember awesome, successful, and smart by ASS, awesome, successful, and smart. And if you say that, it gets yourself out of the mindset and start to feel a little bit better. And then after, if you feel really sad, you can say, I believe I receive, I believe I receive. And you can put your arms up, because it really does make you feel good. You are in control of your thoughts, your outcome. Knowing that simple tool of the CCD and the affirmation and health, throw your arms up, it does make you feel better, and it gets you out of your negative zone, your negative thought space. And, you know, again, you may not be in control of the situation, but you sure in the heck are in control of your outcome.
Stacey Renee with us. She's a motivational strategy speaker and mindset life coach with us on the Oakland County Megacast. So for some people, this is something that they can adopt pretty quickly, but for others, it's going to be a gradual process, because they're used to overthinking things. I tend to be someone that overthinks things, and there's other people that tend to just be negative from the onset and have that negative mindset just naturally. So for them to change how they're thinking, how they operate, how they go about thinking about different situations and changing their mindset, it's going to be more gradual. What kind of steps should they be taking as they're easing into this? Because it's not something you can just flip a light switch on and move to move toward those positive coping strategies.
Right, absolutely. There's a couple of steps. And here's the thing is this, if you're going to think that you're going to wake up every single day and it's sunshine and roses and butterflies are coming at you, I got news for you. That's hard to live up to. And even I don't wake up like that every day. But a positive thought in the morning really does make a difference in how your day is going to be. So when you get up in the morning, when you're brushing your teeth, this is a great remembrance. Have a little sticky note on your bathroom and say something positive or say something that you're grateful for while you're brushing your teeth. You brush your teeth at night before you go to bed. And you can think about the positive things and really start your day off right. If you wake up and you're not feeling good, you're just feeling funky. And I was feeling a little off this morning because I had a headache. I'm like, you know what? Take time for myself, rethink how I'm waking up and just move on my day. So brush your teeth, think of something positive. And the other thing is we have between 50 and 7,500 thoughts a day, which is great. But the problem with that is 90% of those thoughts carry on to the next day. And you're creating a habit for yourself of thinking negative because we always tend to think more towards the negative zone. So when you become negative thinking, it's a habit. So just like anything else, when you're trying to learn something, you have to do it with practice. And the best way is to put, again, little sticky notes, and those are so easy to do, and make goals for yourself every single day, writing them down, before you get on your phone. What are you grateful for? What are you going to accomplish that today that is realistic, arm-length goals that you can accomplish? And if you need something to really get you going, make your bed every day, because at the end of the day, when you go to bed, you can at least see that, one, you accomplished making your bed. And it's the little things that we take for granted that we don't think about. So by those simple tools, way of thinking and reshifting your mind and having the sticky notes, that's really a huge step, is the CCD, it's affirmations. And if you're at a computer, look at your computer. They've got Control-Alt-Delete.
Stacey,
so we can really think differently if we want to.
Stacey, with all these strategies that you can employ just in a general sense, for some people it's going to have to be piecemealed here and there. Like you had said, it's not going to be something that just happens, and it's really difficult for a lot of people. So what are some suggestions you have for people to, throughout their day, continue on this journey and make an effort at this? Because it's something you got to constantly work at. What would be a strategy you would give to people in the morning, right away when they wake up, in the middle of their day when they're at the peak of their stresses, and at the end of their day when they're trying to wind down, clear their head, and get some sleep?
Absolutely. There's two things. One, everybody has a phone. The most important thing is take your phone and put reminders in the morning when you know you're going to wake up. Put a reminder. Say my positive affirmation and things that I'm grateful for. Set it again into the afternoon. Set it again in the around 3 o'clock or whenever you start to have your dip in the day, and set it again for the evening and put it on an everyday reminder. It can't get easier than that. And honestly, that's what I do. I have affirmations on my phone. I have sticky notes. And, if you really want, I got to tell you, I have a book, and it's an intentional, easy read, and it has the steps, it has the tools. You can read and keep that by you. And just, again, it's constant changing. The sticky notes, I have sticky notes all over. I also have a book right here that every day when I wake up in the morning, I actually put, what I'm grateful for, the exercise, because exercise is super important, and then what I'm going to do and I'm going to accomplish. And here's another one. I have in here, everything is always working for me. So sometimes I'll choose a mantra for the day and I will say it all day long. And it kind of puts a little extra pep in my step. If I start to get negative thoughts, I'm like, nope, everything is always working my way today. And again, you have to be mindful of it, just as if you're being mindful of the negative thought. Shift them. Redirect them, get it out of there. If you're having a crappy day, shift it just like that, because you can totally do that. It's just you have to be mindful of it.
These are great tips and tools for us to work on as individuals. But are there any that you could do to help someone else, such as a mom or a parent for their kids?
Absolutely. I have my own kids say a mantra. And when they're starting to get really frustrated, or if they have a bad dream and they wake up in the middle of the night, they actually have a mantra. And it's just a personal one, and I'll share it with you, is I am a very powerful magnet, and I ask and command that all good things that the universe has to offer, that is for my best good, come to me, so be it. It is done now in divine order. Amen and thank you. And it just is something that's personal to us, something that they say. And then we, when we stay together, we start, I am a very powerful magnet, and we get really excited about it. And then we all at the very end, we do the, I believe I receive, I believe I receive, because it really does make you smile. It does change you. And if you don't think your energy and your thoughts are really things, think about when you really start to get so emotional, to cry. Think about it in the opposite sense. When you're really happy and you just get yourself excited, even if you're not, or just put some music on and dance around for the moms who are really having a stressful day, change the tune right there. Don't get upset. Don't continue to feed into it. Turn some music on and just say, let's have a dance party. And it really does help. And if you really need it and you're at work, walk away, go to the restroom, just rethink how your energy is right then and just shift it. It's truly that easy, but you have to be mindful of it to do it.
Stacey Renee with us. She's a motivational strategy speaker and mindset life coach. Stacey, just a couple more minutes with you. You touched on some strategies you provide to your kids when they have a bad dream or they're having a bad day. What are some other strategies that parents can work on with their kids to, like themselves, gradually bring them into a more positive mindset?
If your child is sitting there saying, oh, I'm bored, I don't know what to do, or they're just like, I'm not any good at that. As the parent, you have to be the role model to tell them that if they're sitting there saying, I'm not good at that, they're saying, I am not good at it. You need to help them reshift and say, but you know what? What are you good at? And just start pulling the positive things in to what they are good at, because not everybody's going to be the best at everything, and they are going to be getting frustrated and they're not going to know what to do. Find something fun. Just take 5 minutes out of whatever you're doing in your busy day and just take a few minutes to talk about being positive. Don't turn it into a lecture, because my kids like to say, I do. And I'm like, hey, I'm just trying to tell you I care and I want great things. And think about great things like, oh, well, if you could do anything in the world, what would you want to be? Explore their minds a little bit. Them to think about different things. And, oh, what are you going to say today? I am awesome, I'm smart, I see what I put my mind to. And again, I'm excited, because if they see that you, the parent, are excited, they're going to feed off of that. Just like if you're at a party or you're at, someplace, where do you gravitate to? You gravitate to that person who is lighting up the room, who's having fun. Are you going to go to that person that's just sitting there by themselves? Absolutely not. You're going to be the role model for your kids. You're going to be the role model for the people at work. You're going to be the role model for any place that you go, as long as you control your feelings and you think positively. And yes, I know it's very difficult, but remember the $100 bill, the front side, me, myself, and I, the back side. There's always two sides to every story. And here's the thing, $100 bill has the same value, whether it's the front or the back, and you do matter. And I think we forget about the value of our own selves a lot of times. So be mindful of yourself. If you don't respect and value yourself, how are other people going to? And that's what I really instill in my kids right now, especially for them standing up for themselves during these times because of the social media and people being so into their own thoughts and their own, living vicariously through other people. So just be mindful.
Stacey, we appreciate having you on with us. Anything else before we let you go today?
You can't lead a positive life with a negative mind. And until then, don't coast to neutral, positive shift ahead, and be in control of your own thoughts. I'm Stacey Renee. so much for having me today.
We appreciate having you on. Stacy Renee with us. She's a motivational speaker and a motivational strategy speaker and a mindset life coach with us on the Oakland County Megacast. We appreciate having Stacy on. We're going to take a quick break and we'll come back. We'll reset with some of the top headlines for today, and then we'll speak with West Bloomfield Deputy Police Chief and Public Information Officer Kurt Lawson. After the break, you are watching and listening to the Oakland County Megacast on our family of TV, radio, and other media outlets.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we're on 88.1 WBFH The Biff and Birmingham Area Municipal Access. And thank them for joining us each and every day on our Megacast family of TV and radio stations as we continue to bring you the top news and information from around the Oakland County area Monday through Friday from 10 a.m. to 12 noon here on the Oakland County Megacast and every day on our website at civiccentertv.com/coronavirus, where our top story today. Teachers are protesting in-person classes this fall. A group of educators and parents rallied in protest of schools reopening for their in-person classes in Michigan this fall. The rally began as a car caravan which drove from Detroit to Ferndale High School, Oak Park High School, and Berkeley High School before ending at a park in Pontiac. Districts are coming down to the wire to plan for safety protocols, capacity, and potential hybrid learning. Several school districts in Oakland County have already released their back-to-school plans, which include the hybrid of online learning and in-person classes as well. Others are offering virtual academies. The event was organized by 3 coalitions, including the Michigan for a Safe Return to Campus, which is planning a rally at the state capitol next week. So, Ronnie, these teachers getting close to the school year, many across the state are frustrated with the element of the unknown and in some cases the political push to have schools be entirely in school in the fall, and are having their voices heard as we're getting down to the wire and schools are finalizing their plans for fall education.
Some school districts are making that decision to be completely virtual. And one of the reasons being they don't want to have to pull back midway through the semesters. Teachers, parents, some of them need that decision now so they can plan and be organized for the upcoming semester. And there are some teachers that are concerned about the health issues for their own personal reasons as well. However, some parents also need those kids back in classrooms because maybe they don't have childcare for them.
It's a very complicated situation, and complicated situations require a lot of creative problem solving. There's still some time left to do that for the school districts, between the school districts and their teachers, and between their local school administrations. But time is running out, and teachers are starting to get frustrated. We'll stay on top of that story and have updates for you on civiccentertv.com/coronavirus as we learn more. Other top stories today: 70 coronavirus outbreaks in Michigan last week. The Michigan Department of Health and Human Services Chief Medical Executive Dr. Jonay Caldoun said that coronavirus cases have recently plateaued in the state, but there is some evidence of community spread. As of Tuesday, a total of 79,176 confirmed COVID-19 cases and 6,170 deaths, an increase of 669 new cases since Monday. 31% are associated with nursing homes and adult care facilities. 22% are associated with social gatherings, 10% with workplaces, and 9% are associated with restaurants. Officials say outbreaks have been associated with childcare facilities, agricultural work settings, bars, personal care services, and gyms as well. Outbreaks can vary in size, but it is the process of one or more people contracting the virus from a location and then spreading it to other close contacts who have then had the potential to continue spreading it. That full definition was explained at yesterday's press conference from Governor Gretchen Whitmer by Dr. Jonay Caldoun during the press Q&A session. If you want to watch that, we have both a short clip of that specific section and the entire press conference on our website at civiccentertv.com/megacast. You can click on watch full interviews for the entire press conference and short clips to find the clip from Dr. Jonay Caldoun yesterday. Lastly, a vaccine trial gets underway at Henry Ford Health System. The Henry Ford Health System is seeking volunteers to take part in a COVID-19 vaccine trial. Henry Ford Health System is the only hospital system in Michigan chosen as a phase 3 trial site for the Moderna mRNA 1273 coronavirus efficacy, or COVE, vaccine study. About 90 healthcare systems across the U.S. are working competitively to enroll a total of 30,000 volunteers to participate in the Moderna vaccine study, 5,000 of those from Henry Ford Health System. Participants could receive their first shots of the vaccine by the end of this week. Anyone 18 years of age or older who is not immunosuppressed, immunocompromised, pregnant, or planning to become pregnant can volunteer for the study as long as they have not had COVID-19 or another vaccine or treatment. So, Ronnie, we've talked a little bit about this. It's underway in Henry Ford Health System, based primarily out of Detroit at this moment in time. Dr. Manu Malhotra, the chief medical officer at Henry Ford West Bloomfield, says they are working to have some involvement in that as well. So we'll have more updates on this as time goes on. But good news, a vaccine trial is in phase 3, and it's going on right here in Michigan.
This is a show of how the collaboration amongst the medical community has helped get this vaccine to this point, or at least this trial, and also working with the government to be able to cut through the red tape to get this in the system and get it tested, is so that hopefully this works and we have something to be able to give to the public and we can move past this pandemic, because I think we are all growing very weary by this time.
I think that is very much an understatement, Ronnie. We are several months into this COVID-19 pandemic. It's good news that they're in phase 3 of the phase 3 trials of this particular vaccine. Other vaccine trials are still in process as well. We'll keep you updated on those as we get more information. We're still very much in the early process of the final phase of those vaccine trials. So as the medical side continues to take care of their work in combating COVID-19, so too does the law enforcement side, as local businesses have more regulations put on them in order to keep their staff and the general public safe as they come in and out of their facilities. Joining us now for an update from the law enforcement perspective, he is the West Bloomfield Township Deputy Police Chief and Public Information Officer Kurt Lawson, with us once again on the Oakland County Megacast. Deputy Chief Lawson, thank you for being with us today.
Well, good morning. Glad to be here. I don't know who put me on after Stacy, but I'm going to try to raise up my energy level and see if I can compete, because she does an absolutely amazing job.
Yeah,
it's great to be here.
Oh, yes. Very tough shoes to fill on that end. That is a lot of positive energy from one person. We appreciate having her on. So, Kurt, in the last several weeks, businesses have had more regulations put on them in terms of particularly the executive order from Governor Whitmer requiring mask wearing in all public indoor facilities and all outdoor gatherings where social distancing is not going to be possible. We've spoken with many of these local businesses, and even yesterday we spoke to State Representative Mari Manugan, who very strongly had an opinion that the enforcement of this should not necessarily be on the employees at these locations, but should be on the employers and the local law enforcement. From West Bloomfield's perspective, how closely have you been working with these local businesses since this mask order was put in place, and even beyond that, as they've worked through trying to put their best foot forward in following these rules, following these guidelines, enforcing them properly, but minimizing any sort of incident potential?
Well, that's a great question. So The executive order that you're referencing is 2020-147. That executive order came out on July 13th, and that really mandated that businesses needed to post that in order to come inside the business or the business that's open to the public, that you need to be masked up. And there were some exceptions to that rule, but the question is, how do you enforce this? And we've seen several incidents around the country where an employee or a customer has confronted an individual about a mask, and the situation has escalated, and we've even seen deaths as a result of that. But what we're doing here in West Bloomfield, very fortunately, is we have a great partnership with our businesses. So how we're treating this is, if they have a concern about a customer that's not wearing a mask, they've been giving us a call. We will come over. The business will ask the individual to leave or put on a mask. If that individual does not do that, we treat it like a trespassing complaint. So that person then can be cited as a trespass. Fortunately, though, we have had no issues where we've had to cite anyone. We've had a couple of individuals that preferred not to wear a mask. They were asked to leave, and they did so.
Kurt, we're seeing reports of face mask exemption cards, and you can even Google that and print one off online. Is there such a thing? And if someone presents one to a business, should they accept it?
I am not aware of that card, so I can't comment any further than that. But that's one of the problems with this is, how do you verify? So, businesses just have to use their best judgment. But we are really encouraging our residents certainly to wear masks, to keep that social distancing. I really do believe that Michigan has listened to the medical experts where they're saying, if you wear masks and you keep that social distance, you use the proper hygiene, that we're going to be able to beat COVID-19, and the data supports that.
Kurt Lawson with us. He's the Deputy Police Chief and Public Information Officer for West Bloomfield Township and their police department. Kurt, as we're heading toward next week's primary elections and into the general elections, a lot of local municipalities are doing their part in partnership with Oakland County to provide extra opportunities to ensure that every voice is heard and every voter, particularly the absentee voters who are voting by mail in many cases, are able to have their votes counted and in on time. And to do that, one method they're using are these ballot drop-off locations. They look kind of like mailboxes, and I know West Bloomfield Township has one on site on the library side of Town Hall at the Civic Center complex. There may be some concerns with the safety of those votes, even though the police department is on site there. What is your department doing to monitor that site and ensure that in partnership with the clerk's department, ensure that these voters' ballots are going to be able to be submitted safely, and our voters can be reassured that when they drop their ballots off at Town Hall, they won't be tampered with?
So we've been in contact, the chief and I, with Clerk Binder and her team several times a week. They put a metal security box that's clearly labeled on the west side of Town Hall where our residents can go ahead and drop those ballots off. So there's no concern on our part that there's going to be tampering with those ballots. And we have our officers extra patrolling in that area on a daily basis. So I'm very confident that those ballots are secure and that every vote's going to count.
Good to hear that. For the residents of West Bloomfield who are voting absentee and submitting their ballots, you can do that at Town Hall. There's a ballot drop box, as we mentioned, on the West Bloomfield Library side of the building. Kurt, you have some new recruits that have joined the police department. We saw a picture just a day ago of a picture being taken inside Town Hall with Clerk Binder swearing these new officers in. With all the tension surrounding policing in the United States and in our community, what advice are you giving to these new recruits? And as they're coming in, what is your department emphasizing as they begin their career in law enforcement in some cases, or begin their career in the West Bloomfield Police Department?
Well, it's been a difficult process over the last 5-6 years on just recruiting the top quality people that we're looking for. And we won't settle for anything under the top 1%. And we want to find individuals that represent the diversity of our community, individuals that are tech savvy, ability to communicate, and of course we need to have common sense. And you put all those things together and it kind of lowers that candidate pool. And then when you see all the negativity towards law enforcement national scale, it's been very difficult for us to recruit. But I am happy to report that we just got 3 amazing individuals, Quentin Gaines, Adriana Peruzzi, Chris Salida. All 3 of them were police service aides within our police department between 1.5 years and 2 years. We got a great relationship with them. We got to see them over a period of time and see their work ethic and how they treated the community at the front desk. And they just got done with the police academy and they just came on, got hired, sworn in by Debbie Binder. And we're thrilled to have them as part of our team.
Well, Kurt, we thank you for being on with us. Just another minute or so with you. Anything else you'd like to touch on today before we let you go?
Well, I think you touched on it a little bit. Like, there's certainly concerns from leaders in law enforcement about where our profession is going. We've seen reduction in pensions throughout the country. Benefits have been reduced. And officers are really asked to be the jack of all trades. And it's a difficult situation that we're in. But here in West Bloomfield, we have the support of our trustees, the township supervisor, and of our residents, and we just greatly appreciate that. And we're going to continue to be what I consider maybe the best, if not the best, police department here in Oakland County, and that's because of the support of our community, and we appreciate that.
Kurt, real quick before we let you go, if someone is interested in joining the force there in West Bloomfield, when is the next class and what are the steps needed to get started?
So just have them email me here at the West Bloomfield Police Department or call the West Bloomfield Police Department and we'll point them in the right direction. We are always looking for candidates. It's not just a certain period of time where we're accepting applications. So we would be more than willing to talk to anyone out there who has an interest in law enforcement as a career.
Well, Kurt, thank you very much for being with us today.
Take care. Thanks for having me.
You as well. Deputy Chief Kurt Lawson and Public Information Officer as well for the West Bloomfield Township Police Department. We appreciate having him on and discussing the continued battle against COVID-19 in West Bloomfield in our community, as well as how the police department continues to cope with some animosity on a national level toward police departments in general, but a police department that's generally been well received from the community, including people in more marginalized communities during this time, with the conversations that they've been having and the actions that they've been taking and the continued efforts to do quality policing and be quality community members. It's good to see that they are getting some new high quality recruits coming in and are continuing to look for new recruits at a high level.
I've worked with Kurt in previous capacities, and West Bloomfield is extremely lucky to have him and the chief over there. And one thing that they're really good at doing is trying to connect with the community, humanizing the badge so that people understand law enforcement officers are people too. They come to work to protect and to serve, and it's a very tough time in law enforcement right now, but they are committed to the community, committed to the people, and they really do want to make this area better for everyone that lives here. And anyone who is interested in becoming a part of their team, it's a great team for you to join and to look into. If anything, though, just pick up the phone, make a call over there, talk to them about what is the day-to-day life like as a police officer here in West Bloomfield.
Yeah, they are a very supportive community outlet. They are very much welcoming to the community for any questions they may have on law enforcement, on potential, whether it be on potential careers or how they operate their department, and they're very open with that information. You don't see that in a lot of places. You definitely see that in West Bloomfield. We always appreciate having Kurt Lawson and other members of the West Bloomfield Police Department team with us here on the Oakland County Megacast. Just another couple minutes left in our show before we have to wrap up today. So before we go, I'd like to remind you again, you can find your top stories of the day about coronavirus and other important news in the local area on civiccentertv.com/coronavirus. Of course, we have our top stories that Ronnie and I have gone through today, as well as links to reputable resources such as the Centers for Disease Control and Prevention, the state of Michigan, and Oakland County's direct COVID-19 related web pages. You'll find information that you don't have to question. It's from reputable resources in the medical community on the front lines battling this disease at the federal, state, and local level. In addition, on civiccentertv.com/coronavirus, we have links to your local municipalities for more information that you may need to know in your hometown. In addition, civiccentertv.com/megacast. You can find all the information you need to know on what is a megacast, what do we do each and every day, who are we partnered with, find more information about our partnering community TV and radio outlets, as well as on-demand access to our full episodes, short clips, and interviews from the Oakland County Megacast each and every day, 10 a.m. to 12 noon, live here on Civic Center TV and our family of stations, and on demand afterwards. That is going to do it for today's edition of the Oakland County Megacast. We appreciate having you tune in today and hope that you'll be back with us tomorrow for more of the Oakland County Megacast on our family of stations. For our entire crew here at Civic Center TV, Lakes FM, and our partnering stations, I'm Tyler Keefe alongside Ronnie Dahl. Thank you for tuning in. The Oakland County Megacast will return on Thursday.